Alright, so I'm going to perform wound care on my patient's right lower extremity. I will have provided privacy, introduced myself, done patient identification ×2, gathered my supplies, performed hand hygiene, and applied clean gloves. I will have asked the patient if they had any pain and administer pain medication before doing this. Been used a couple times. So the first thing I'll do is remove the outer dressing by peeling towards the wound. Next, I would take my little tweezers and remove the dressing and note any drainage. So I have some serosanguineous drainage. So now that I've removed and exposed the wound, I'm going to change my gloves. I would change my gloves, perform hand hygiene, and apply new gloves. Next, I'm going to measure and clean the wound. So to measure, I'm going to measure the depth by using a Q-tip and marking the depth of the wound and measuring it with my measuring tool, which is 2.5 centimeters deep. I will also measure with measure the diameter. So this is the head of my patient and this is their foot. So I'm going to measure, and my patient has a 4.5 centimeter wound from 12 o'clock to 6 o'clock, and from 4 o'clock to 10 o'clock, it's about 3.5 centimeters. Next, I'm going to clean my wound. I'm going to start from, I would clean with like some sterile water, just from the inside of the wound to the outside. I could use some sterile gauze that has been moistened, and I would do the same thing, start from the inside to the outside, from the least contaminated to the most contaminated areas, and changing gauze or Q-tip every time I do that. So now my wound is clean, so I'm going to change my gloves again, perform hand hygiene, and now I'm going to apply the new dressing. I'm going to take my gauze, my sterile gauze that can be slightly moistened, and I'm going to press it into, I would also look for any tunneling. I'll press it into my wound, but not too tight. And if there is tunneling, I want to make sure I measured that and got that in there, but this one did not have any tunneling. And then I will apply the bandage, and I would initial and date that the dressing was changed today. And then I would remove my gloves and perform hand hygiene.